person who signed up for public comment, Kevin Fitz from the Oregon Mental Health Consumers Association. Kevin, you have about 3 to 5 minutes yep, right there. Just introduce yourself and jump in, and I'll let you know when you're getting close to the end of your time.
I'll just go fast. My name is Kevin Fitz. I'm the founder and chief volunteer for the Oregon Mental Health Consumers Association. I've been a public mental health client and in recovery from addictions in and out of public services since 1986. What I'm here today for is to speak on behalf of peers in Oregon. I've made a brief handout. It's called Peer Apocalypse, but that's just their marketing name. It's just basically a state mental health consumer, behavioral health consumer conference that has been happening annually for the last 3 or 4 years. And I am here to make, just to request, I'm not actually sure about how things work because I'm new to some of the new reformation of the Oregon Health Authority. I'm not sure exactly how requests of funding takes place within your 2 advisory councils slated to advise behavioral health policy, and that's the Oregon Consumer Advisory Council and the Adult Mental Health Planning and Advisory Council. So what my basic gist here is today is just to put in front of you that I would like a recommendation from Kate Brown or Jeremy or from Lynn to say that we think it's important that our consumer members, our unemployed folks on disability who represent people with behavioral health and addictions on our councils, that we support them to attend this statewide consumer advisory, this consumer conference. Historically it has happened. This conference has only been going on for 3 years, but when I was quite active in the 1990s, the state actually supported a consumer-wide network called the Oregon Consumer Network Incorporated and helped fund that to some degree. I sponsored 2 conferences in 2000 and 1999. The state, under Bob Nickel and Madeline Olson, gave significant financial support to sponsor people at the state level to attend. And just a brief bit of fact, most folks who live on SSI and SSDI who have behavioral health issues in Oregon make $9,000 a year. So my request, there's a little bit about sort of, one alcoholic helping another, the policy ideas, that sort of thing. And one of the things I'm bringing to your authority is there's been some discussion with some state mental health or behavioral health officials about, well, we're not sure whether we can use the block grant for this funding or not for this sort of funding. And I've reached out to my compatriots across the country, and I've asked them, so what have you done in regards to helping support your consumer members to attend peer or consumer advisory and policy initiatives throughout your state? So I gave you 3 examples in the very back part of that. Some of this talks about what the block grant funding is, and then the small pages list all the commitments that your behavioral health department said to SAMHSA when you give us this $35 million block grant or substance abuse and mental health, what we will do as far as peer initiatives. So that's basically it. I'm not actually sure what you can do regarding these 2 other advisory councils. I just want to put this in front of you, let you know we met with Senator Jack Merkley's constituent services 2 weeks ago. We're meeting with Ron Wyden's staff and saying, is there any way that you could put some federal pressure, because some of this is a SAMHSA requirement, to have a state adult mental health advisory council to support them in attending and networking at this mental health consumer conference. So that's my spiel.
Cool.
Does that make sense?
It does. Mr. Fitz, thanks for the information, and thanks for the testimony.
Cool.
Appreciate it.
Thank you. Nice seeing you again.
Nice to see you.
Health Policy Board meeting is...
Before Mr. Fitz leaves, I just want to say that we received this inquiry, I think, from another source, and Leslie Clement is looking into availability of funds, either through CCO's funds, health systems funds, et cetera. That's not a commitment of funds. That's just that we're looking at it, and I appreciate you bringing it forward.
Cool. Thank you.
With that, this meeting is adjourned. Our next meeting is February 2nd. We're still working on the location. That's for our Health Policy Board retreat. So thanks.